Good afternoon, everyone. Thanks for joining us again. A new location. Moved to the conference room today. I want to thank our American Sign Language interpreters for joining us. Before we get started, I promised last time that we would be sure to have detailed information regarding nursing home visitation. So let me start with that. I want to go right to nursing home visitation when I pull that up on the screen if we have it. Although I could probably just get through it. Make sure we have it. There we go. Okay, so as you know, the state did make some alterations. It is not a perfect science, however, or a perfect plan. Nursing homes have been receiving vaccine doses through a federal relationship with pharmacies. I will say that that has come to a close. County health departments like ours are coordinating with local nursing homes to identify new staff and new patients coming into the nursing home. And as that happens, we are to work to ensure that they receive access to vaccines. And our nursing home task force has been working directly with them. I want to thank Mario and the entire team at the Department of Behavioral and Community Health who've been working with nursing homes these last 12 months now directly. So as it relates to vaccine information, you should know that. Now, visitation is allowed with some restrictions. So facilities must be COVID-free for 14 days. So no COVID-positive cases for 14 days in a particular nursing home facility. Visitation must be kept under 20% of the resident population, 100 people. 20% is obviously 20 individuals. So visitation less than 20% of the total resident population. There is a testing requirement for nursing homes, and that depends on the county's positivity rate. So for counties below 5%, which we remain currently below 5%, there is not a testing requirement. No testing requirement for visitation-related issues, right? For those between 5 and 10%, testing is required, and then above 10%, visitation is only allowed for compassionate care situations. So we remain under 5%, no testing requirement. Rapid testing may be provided by the facilities, and the New York State Department of Health has offered assistance in accessing rapid testing. So the rapid test is an available option for the testing requirements if they are necessary. Currently, we fall below the testing requirement. Visitation can occur in private rooms, dedicated visitation spaces, and outdoors, and the facility can determine limitations on individual visitation hours. Those are the current visitation rules as defined by the state of New York. The county's health department has been working. We've been working with those nursing homes to address their particular needs. And as I said, we've been attempting to coordinate with them access to additional vaccine doses for new staff and new patients as they come into the facility. Let's jump back, sorry, Sean, jump back to the dashboard. And then we have a lot of information to get through. So we're going to try to get to questions as we can. If you have one, write it in the comment section below the live stream. But we have a huge amount of information to cover today. So very quickly, we're tracking 1,058 active cases. We've plateaued. I think that you should know that. And we've seen this in other states where we've seen a reduction. New York's seen a reduction. We've seen a reduction in active cases. But then we've kind of, in most states across the country, we've seen this sort of plateauing. We're kind of plateaued in active cases. We've been at about 1,000 active cases on any given day. We've dropped below 1,000. We've been a little bit over 1,100, but we're basically at about 1,000 active cases on any given day right now, which means we really do have to pay attention, again, to our own behavior. Obviously, continue to be vigilant in following those mitigation steps, face masks, physical distancing when appropriate, monitor your own health, obviously be cognizant and aware of that. But we're at about 1,000 active cases. We're currently at 33.4 new cases per 100,000. Now, this is a new data point we're providing because it does inform us on school activity principally. The CDC points to new cases per 100,000 is one of the metrics that we ought to be paying attention to provide greater access to schools, and we want our kids to get back to school. So we're actually at the moderate stage. This is below where we were last week. We were at about 36 active cases, new cases per 100,000. We're at 33.4 now per 100,000. Currently, 48 individuals hospitalized in the county. It's relatively low, comparatively speaking. And the positivity rate, the 7-day rolling average for the county, is 4.25%. 4.25%, which again we've been at basically 4% these last couple of weeks. So as I mentioned, we're sort of plateaued in cases, something to monitor. There is the likelihood that we see a little bit of an uptick, so we do want people to remain vigilant. We've seen that, by the way, in other states that saw an earlier plateauing, and then the cases kind of ticked up a bit. We expect that we're going to experience that here as well, but we want to be aware of it, remain vigilant, follow those mitigation steps that we've talked about. Now let's talk a little bit about vaccine progress and where we are. So Dutchess County remains, as you know, 1.5% of the total New York State population. We represent 1.5% of New York's population. 13.5% of Dutchess County's residents have received their first dose. So it's a good number to watch. 13.5%. I guess we have to update that slide, but nevertheless, 13.5% of our population has received the first dose, and that's just about 1 in 7 residents. So it's a little below the state average. The state average 14.8 in the region. Only Westchester County exceeds the state average, and of course, an average is what it is, right? It's between the higher and the lower. So there's always going to be somebody above and somebody below. But that said, we are seeing a pretty extensive increase in doses this week, and I'll get to that in a moment. So 13.5% of our population has received the first dose. As I said, that 14.8% statewide average. 39,670 Dutchess County residents have received their first dose. So nearly 40,000 Dutchess County residents have seen and received their first dose. So let's get to vaccine distribution this week. We are seeing, so this week we have the largest allotment of doses to date. This is a substantial increase over last week. The total allocation to the Dutchess County to the Dutchess County Health Department is 4,040 doses. Now this is up from 1,200. So we're now administering 4,040 doses. Now that includes an expansion of the Moderna shots, increase in the Moderna shots, increase in Pfizer shots, and we will start to see the rollout of the Johnson & Johnson single doses as well. So what are we doing with these doses? Number one, we are expanding our partnership with a number of providers. So in order to address and begin to assist homebound seniors and those with comorbidities, we are partnering with a couple healthcare providers, Caremount and Premier, to assist in identifying homebound seniors. So this partnership is pretty extensive, working with Premier Medical Group, Caremount Medical, and Sun River Healthcare. We are establishing a broader distribution structure that will include homebound seniors through those partnerships, homebound seniors, along with homebound senior citizens, along with other patients with comorbidities. So we've been ready for this. We've been preparing for this, and our Medical Reserve Corps volunteers and Department of Behavioral and Community Health staff have been actively engaged. We are also going to see a series of pop-up sites. Let's talk about those in a minute, starting at Marist College. So off campus, Marist College with the state of New York, and we'll be coordinating in getting lists to them through use of the Johnson & Johnson site later this week. Appointments will become available for 500 shots per day. This will be a pop-up clinic between Westchester Medical, New York State Department of Health, and Marist College. We'll be assisting them in sharing the appointment link so that individuals can choose to be scheduled. You'll have to schedule separately through the state site, and as soon as that link is made available, we will push it out to our Dutchess County vaccine wait list, our database. Again, partnership with Premier Medical Group, partnership with Caremount Medical Group, partnership with Sun River Healthcare, for outreach to homebound seniors, to those with comorbidities all across Dutchess County. We will see the establishment of a pop-up. This will be for a week, a pop-up off the Marist College campus between the New York State Department of Health, Marist College, Westchester Medical Center, and the County Health Department, getting those names and appointments scheduled. Additionally, as I said, we are partnering with federal healthcare clinics, as I mentioned, to broaden accessibility. So this coming week, again, if you're interested in continuing to look for access to the vaccine at state facilities, the state Mid-Hudson Regional site is the Westchester County Center in Westchester County. And of course, there is access in close proximity, if you will, to SUNY Albany as well. You want to visit the Am I Eligible, make use of the Am I Eligible tool with the state of New York to access those locations. Now, there are about half a dozen pharmacies across Dutchess County with doses this week, and you should visit the dutchessny.gov website to access that list. And as I said, if you visit dutchessny.gov, if you scroll down that site, that page, you'll be able to see some additional locations that will have appointments available. So Walgreens in Poughkeepsie, Walgreens in Wappinger, Price Chopper in Poughkeepsie, Pleasant Valley Chemists, McCarthy's Pharmacy in Stanfordville, Pine Plains Pharmacy, and other locations including CVS, Tops, and Stop and Shop all have doses. Mid-Hudson Regional administering 800 doses this week. And as I said, the federal clinics, the federally qualified healthcare clinics across Dutchess County, including Sun River Health, are administering an additional 300 doses. So this is the largest allotment in number of doses that will be administered across Dutchess. That's over 6,000 total doses this week, not including the 500 per day that we expect at the Marist College Clinic, which will be open to the public, and appointments will be made available to you once the state link is made public. Additionally, I want to mention as far as what you'll be seeing over the course of the next couple of weeks. So with the increased doses, we are also expecting access to the Johnson & Johnson shots. We expect to have this week an additional a first round of 800 doses available to us. And over the course of the next 2 weeks, we're going to start having localized pop-up clinics. Our goal is to be in southern Dutchess first. We're working with East Fishkill and hopefully the city of Beacon. We try to get a pop-up clinic in the next 2 weeks there. We're then also partnering with Brookmead in Rhinebeck and Walgreens there to Walgreens or Rite Aid. I want to make sure I got that right. The Rite Aid? It's Rite Aid. I apologize. So we're also organizing a pop-up clinic currently. That's going to occur in another week at Brookmead in Rhinebeck. That, again, focus on Northern Dutchess residents, and that's in a partnership with Rite Aid. And that, again, a large expansion in the distribution of vaccines this week. And I'll get back to that in a matter of moments. I'd like to repeat that information in a way that's a little bit more structured for you so you have it. Good question, who's allowed to go to the Marist pop-up site? That'll be open. It's a state site, so anyone's allowed to, if you will. We will be, as soon as the link is made available by the state of New York, we will send it out to Dutchess County residents on our wait list, because we want to localize that distribution to individuals in and around the Poughkeepsie Marist campus. So as soon as that link becomes available, you'll be getting an email. And again, that's supposed to be a daily operation for 7 days. And as that happens, you'll be able to schedule your appointments through the state link. But we will share that link to Dutchess County residents on our wait list, which is a good time to remind you to sign up on the county's wait list. We've said this for a while, and I've been asking supervisors and mayors to do the same. Please encourage people to sign up. I know that you don't necessarily want to have to wait, but by having this particular wait list, as opportunities become available, we can send them to you. And I will say this, been very grateful to work with the state these last several days. We've been able to really expand access, and that's useful. The system is still a little bit chaotic in scheduling appointments, but getting more doses makes it easier for us to direct services and doses to particular areas. So let's do this one more time, Sean. in the next 2 weeks, this is what you're going to see. Beginning this week with doses at our pop-up locations. But again, Dutchess County's health department is going to be distributing about 4,000 doses this week. We're partnering with Caremount, Premier, and Sun River Healthcare for direct connection to homebound seniors, and that will begin along with seniors with comorbidities in their particular areas. So again, we'll be able to expand the reach. We're going to be partnering with Sun River on a pop-up clinic that we hope will continue in the city of Poughkeepsie. Marist College, as part of a partnership with New York State Department of Health, the Westchester Medical Center, and Mid-Hudson Regional, and our own health department will be directing appointment opportunities at that clinic. And over the course of the next 2 weeks, Dutchess County's health department it's a good question. Dutchess County's health department will be establishing pop-up clinics, currently one in Rhinebeck, and that'll be through a partnership with Rite Aid, and they're reaching out based on our list. Again, if you're on our list, we will advise you of the appointments. And so if you're on our list, we'll advise you of the appointments. Again, first pop-up clinic, Brookmead and Rhinebeck, followed by, within the next 2 weeks, one in East Fishkill and Beacon. And then we've agreed to get a pop-up clinic scheduled in the Millerton area. So you're going to see us sort of move around a little bit with those pop-up clinics now that doses are readily available. If you don't have access to the internet and you'd like to get on our list, or you know somebody who would like to get on that wait list, you want to dial 845-486-3555, 845-486-3555. And if you do, if you press 1, you're going to get a vaccine update. You can go through and listen to that vaccine update if you'd like, or press 2. If you press 2, you're going to go to an Office for the Aging representative who will assist getting your information into the county's wait list. And remember, when you sign up, you can sign up for someone else if you're want to help mom or dad or an individual in your life that may not have ease of access to the internet. Make sure you're providing their information. It's important that you give us their information. It could be your contact, right? You want to sign up, mom. You can be the point of contact. You can give us your email and your cell phone number, but the data and the information related to the patient, the individual, must be that person's, and that's useful to us. Good question for the Marist pop-up. The Marist pop-up is the Johnson & Johnson dose. It's 5 days in with the Johnson & Johnson shot, and as I said, it'll be over 7 days that pop-up will occur, and you'll again, once that link is available for appointments, we'll push it out to you, and you can make the choice if you'd like to be considered for that. Sean, did I have you bounce around enough? Mm-hmm. Good. I'm glad. That was my goal today. Let's also talk a little bit about some of the updated information that is that was now made. Let's do weddings first. I know you have a nice little slide about weddings. Those are cute wedding bells. I'm not sure if people use wedding bells anymore, but nevertheless, there they are. It's a picture of wedding bells. I don't know. You use bells at your wedding? Huh. Okay. Well, there you go. Well, somebody used a bell at their wedding. Sorry, it's been a long week, and it's only Wednesday. Beginning March 15th, large weddings can begin. It's the responsibility of the event venue, facility owner operator, to enforce the basic rules. But everyone attending the event, has to provide contact information for contact tracing. Masks are required by guests and staff. Maximum of 10 people at any given table, and the event cannot go past midnight or Saturday before 5 a.m. This is great. This is not what I. This is some detail. Additionally, wedding venues may have more than one wedding on their property at one time, so long as the two weddings do not share any rooms, facilities, etc. Each guest must have been tested negative prior to the event, and that the guests should have proof of negative testing to the facility operator upon arrival. It is acceptable to make use of the PCR test. That's within 72 hours of the start time. Rapid testing within 6 hours of the event time. and the venue itself may perform rapid testing. That's the information we have. I'm not getting into greater detail than that, but that is to say that if you have a wedding organizer or you're at an event location, they are to work with the couple and those involved to be sure that these are the rules followed. And again, we are basically the venues and the organizers themselves will be held responsible for making sure individuals have their negative tests and go through that particular process. So that's important for you to know. Has the state answered any requests regarding the mass vaccine site in Poughkeepsie? Short answer is the state hasn't answered yet. I do want to thank Senator Sue Serino, along with Assembly members Kieran Lawler, Dee Dee Barrett, Jonathan Jacobson, for signing off on another request to the governor asking that the JCPenney location be added as a larger distribution point. Now, that said, between first doses and second doses, we are really making some advancements at the JCPenney location and all of our local health department clinics. So 4,000 new doses this week, 800 Johnson & Johnson shots this week, on top of thousands of second doses. So we are making relatively good headway now with the increase in doses. We're grateful that the state's working with us, but we still are going to advocate for a larger distribution point here in Dutchess County. We're grateful that Senator Serino organized that with our delegation. Again, Assembly members Dee Dee Barrett, Jonathan Jacobson, and Kieran Lawler for advocating for a Dutchess County location where we can expand capacity. Additionally, announcements today. And I want to make sure that we're going through that. We know that if you're vaccinated and you're traveling within the country, there's no quarantining requirement. And is that true for everybody now? I thought that was now everybody, but that's not what my notes say, so somebody wants to confirm that. Beginning March 22nd, a change in the gathering restrictions for the state of New York. Social gatherings can increase from 50 to 100 people now for indoor events, and 200 people for outdoor events. So basic community social gatherings can increase to 100 indoors, 200 in outdoor activities. In your home, and I don't have 25 people I want at my house at one time, but nevertheless, beginning March 22nd now, instead of just the 10-person limit, we're up to now 25 individuals. And beginning April the 2nd, arts events, entertainment venues can all open with 33% capacity, with a limit of up to 100 people indoors, 200 people outdoors, and can go up to 500 people if mandated testing is met. So if there's a testing requirement, you want to have a large community entertainment event where there's a fixed sort of timeline, you're all convening at the same time, going to the same location, that now is increased to 500 people with that testing requirement. Good question. Will schools go to 5 days per week in person? Schools can go to in person, and we support getting kids back into the classroom. Schools can return in Dutchess County using the CDC and the state guidelines. Schools and students can get back to school. They do, however, have to meet certain mitigation requirements. Those include wearing a mask, doing the individual health assessments, and maintaining physical distance when possible. And so that's a decision for a school, right? If they don't believe that there's adequate ventilation, or they don't believe that they can manage sort of the some of the mitigation steps, they can choose to remain in a hybrid model. They can choose to restrict certain physical distancing. But our health department has advised that under the CDC guidance currently, because we meet this low moderate risk standard, that social or physical distancing should be maintained when appropriate and when possible, and that there would be settings where that isn't possible. For instance, and this is up to the school district and up to you as a parent, it's understood that in a bus setting, you wouldn't necessarily have the physical distancing to be maintained. But in a classroom, you might be able to maintain that. So if you're following the health assessments, if you're wearing a face covering, if you're doing some surveillance testing, a school district could decide to limit the physical distancing in a bus setting, but maintain some physical distancing in a school setting. Bottom line, there is no strict prohibition on children not returning to a classroom. The question is for the district, can they meet those basic CDC expectations of maintaining those mitigations to protect protect your health and the health of others? If they feel they can return. If they feel they can't, they're going to work with parents to meet whatever expectations they have. So the health department, our health department, continues to work with districts. We support getting kids back into classrooms. If a district has a question, we'll try to provide them some assistance. But there is greater latitude now given to school districts by the state of New York and the CDC requirements, and we fall within that low to medium risk where some of those restrictions are lessened. I want to confirm that for travel, if you're vaccinated, there is no quarantine requirement. So fully vaccinated individuals, either those who have received the Johnson & Johnson shot, single dose, or have completed their two-dose regimen with the Pfizer and Moderna shots, there is no quarantine requirement for traveling. So if you're fully vaccinated and you're looking forward to getting out to visit family or some mid-spring break of some kind, please be responsible, and you want to be. But if you're fully vaccinated, there is no quarantine requirement now in the state of New York. How's that? You like that? You want to go back to what we're doing? Well, let's go back quickly to what you'll see this week with distribution. Again, our largest allotment in several weeks. This includes Moderna, Pfizer, and Johnson & Johnson shots. This, so you know, is 1,700 Moderna shots, 2,300 Pfizer shots, 500 per day Johnson & Johnson shots at Marist, and we were just alerted that the county will receive 800 Johnson & Johnson doses as well. Through a relationship we will establish in partnership with Premier Medical Group, Caremount Medical Group, we'll be coordinating outreach to homebound seniors and to senior citizens with comorbidities. That will become, those appointments will be available, and those organizations will be working with us to connect for appointments. Sun River Health Care, the federally qualified health clinic, not only has its own allotted doses, but they'll be working with us to increase their allotment and conduct pop-up clinics in the city of Poughkeepsie first. Now, second to that, because we now have access to Johnson & Johnson doses and additional doses through a partnership with Rite Aid, we'll be hosting a pop-up clinic at Brookmead in Rhinebeck. Johnson & Johnson shots will be available through a partnership between the Westchester Medical Center, New York State Department of Health, and Marist College. That will be a 7-day pop-up clinic, 500 doses a day. And then additionally, we're going to begin administering Johnson & Johnson doses at pop-up clinics. We expect we'll be first in East Fishkill and Beacon, and then we're going to get to Millerton and Northern Dutchess. And you will see all of that in the next 2 weeks. So do be prepared, all while we're administering the thousands of doses to essential work staff, to those with comorbidities, those with developmental disabilities, and others at our existing clinics at the JCPenney's location and CVS in Dover. What are we doing to help seniors get vaccinated? Well, I kind of covered some of that, but I'll do it again. So first and foremost, if you do not have access to the internet, this is where you start. And I will tell you, I've asked supervisors and mayors, I told them I'd tell the world that we're doing this. We've asked towns, villages, and cities to use their senior citizen town hall staff, senior center staff, recreation staff, and others to please help seniors get registered. And you can do it. You want to be helpful to your neighbor, or maybe you have a Girl Scouts group or a scouting group, or maybe as an athletic club, or just you have young people want to volunteer, or you want to volunteer yourself. You can be helpful by assisting somebody who may not have access to the internet, either telling them to call this number, 845-486-3555, or you can help them by filling out our vaccine information form, our wait list. This is where you're going to go to sign up. You can do this, and you can be helpful as well, and we encourage you to. Anybody can sign up, anyone else, at duchessny.gov/vaccine info form. If you go to our website at duchessny.gov, you'll see right at the top right a button that says vaccine information. You'll click on that, and then a subscription button. You'll see vaccine information subscription. You can help sign people up. So if you know of somebody that isn't signed up yet, sign them up. The very worst case, is that they choose not to get their vaccine, but we want them on the list so that we can at least ask. And so by helping people to sign up, we'll get you into this database, this wait list, and as appointments become available, we'll tell you. For instance, the Marist College pop-up, as soon as those links become available, we're going to email you. We're going to tell folks that these are available and that you can get to the state link and sign up. Additionally, as appointments become available at our existing our existing pods, we're going to email you, or we're going to use the contact information you provided to contact you for potential appointment. And when we have our pop-ups, we're going to localize it. So we're in East Fishkill. We're going to try to reach out to a good population in Southern Dutchess. In Beacon, same thing. Out in Millerton, same thing. So by signing up on that vaccine information form, it'll be very, very helpful. Here it is at dutchessny.gov. Vaccine info form. Why aren't we prioritizing teachers for vaccination? We are prioritizing teachers for vaccination. In fact, we dedicate just about half of our allotment every week to doses for essential workers. Overwhelmingly, that is school districts. So the two essential worker populations that we've been focused on these last 11 weeks, and by the way, we're required to provide equity of access to those essential worker groups, are fire and police, and school districts. So we are, in fact, giving priority to school districts. In fact, every week we provide specific allotments to every school district in the county. And if you're a school district employee, the school superintendent and their offices make the determination as to who gets those slots in any given week. Every week they're dedicated. And as we complete certain essential workers, so as we finish up fire districts, and we've actually finished up many, and we're very close to finishing up police agencies. As we complete those organizations, we then take those allotments, those doses, and expand the numbers we give to school districts. So we are giving priority. And school districts and school teachers are able to qualify in that way. I will say this, though. I have gotten calls from people who say, well, why not us first? Because when you go first, someone else goes second. And so what we are trying to do is make sure that we're dedicating the allotment we can to those who are essential staff, teachers, fire, rescue. And as I said, as we close down and we don't have any more individuals to vaccinate in any one of those categories, we expand the numbers, and school districts have been very, very satisfied with the way we're doing this. But in the same respect, we also have other doses that we want to be sure get to individuals with vulnerabilities and comorbidities. We're also mandated to. The state of New York tells us how many doses are available to which population, and we're supposed to balance that. Now, do we follow it firmly? No, we don't, and the state doesn't expect a firm adherence to those numbers, but we do need to be sure that we're dedicating vaccines to essential workers, fire, rescue, police, school districts, daycare, transit workers. Those who work at grocery stores have been identified by the state as priority workers. We also are required to distribute vaccines to individuals with comorbidities, and so we have to identify that population and provide access to them. These are the comorbidities. We also were mandated, at our request, to be sure that those with developmental disabilities have access. Those with Down syndrome have a 10 times greater chance of succumbing to the virus than others. So making sure we get to those populations. So these are all the categories that we have to focus on. I know that there are populations of folks who want more for them, but I will tell you, when it comes to school districts, we've not had any complaints from the districts themselves. We just don't have more access to doses. This week, though, as I said, you're seeing a massive increase in the number of doses thanks to our work with the state of New York, and we're grateful for that. If you have an additional question, write it in the comment section below the live stream. Happy to get to some more questions as well. Do want to mention that we have launched our Vaccine Equity Coalition. This is a group of stakeholders throughout Dutchess County to represent different populations, in particular in underserved communities. Now, underserved communities can be black and brown neighborhoods. It's also individuals without direct access to health care. And so through this Vaccine Equity Coalition, we're going to be doing much more outreach. First, now that we have a little more doses, to communities, encouraging folks to sign up. Got to get on the wait list. And make sure that you're in the system. That's the way we're able to get to you. And then to reach out into communities to talk and provide answers to questions for those who might have some hesitance or questions regarding the vaccine. So that's all important information. We're engaged in it. Do want to mention we also have on March the 9th our Individuals with Intellectual and Developmental Disabilities Service Public Forum. This is March the 9th at 5:30 p.m. We are, as you know, we're a Think Differently County. We truly believe in the goal of providing service and assistance to those of every ability. And every year we have a forum to talk through some of our programming and services. It's an important year to talk really about what we experienced with those who are most vulnerable and what service changes might be necessary in the months and years ahead. If you'd like to participate, you can do so here at dutchessny.gov/forum comments. dutchessny.gov/forum comments. You can submit your comments and participate in that IDD public hearing. If you have a question, right down in the comment section below the live stream. I think we covered a lot of ground today, Sean, and I want to make sure that we touched on just about everything again. Our next Facebook Live Town Hall is scheduled for Wednesday, March the 10th, so next Wednesday at 3 p.m., and then we'll have our telephone town hall and Facebook Live event on Wednesday, March 24th at 5:30 p.m. And again, you want to be here for those, and happy to get to as many questions as we can. Are the Medical Reserve Corps volunteers qualified to administer vaccines? If they've been trained to, yes. In fact, most of our vaccinators are, in fact, Medical Reserve Corps volunteers, and many of our Medical Reserve Corps volunteers have a long history and experience in the healthcare field. And I would note, we have been tremendously blessed and so grateful, not only to have great staff at the Behavioral and Community Health Department, but our Medical Reserve Corps volunteers have just been tremendous. And if you've been to any one of our clinics, you know that if they're wearing a blue or yellow vest, they have just been doing tremendous work. The Blue Vest Medical Reserve Corps volunteers have just been tremendously helpful. And again, by the way, working every single day now, getting the clinics up and running. They're responsible when we do the pop-ups, just doing wonderful work. Who's eligible at the Brookmead location? This is, again, because it's it's in concert with a pharmacy. This is senior citizens. So senior citizens first given access through the Brookmead pop-up, and that is, again, in partnership with Rite Aid. So that is a pharmacy location. Pharmacy locations can only provide access to seniors. So starting there, Brookmead, and again, if you're on our list and you're a senior citizen, first within Northern Dutchess, so that's Hyde Park North, you're going to be considered for those slots, and we're going to try to get through as many as we can. And this won't be the only pop-up. We're going to be back, and the goal here is every week to have one or two pop-ups in different locations. We use the term sort of like a traveling circus. We're going to take the tent, we're going to get in the car, we're going to come to your location, set up, and administer the vaccine in any number of locations. So Brookmead, East Fishkill, Beacon, Millerton, and we're just going to keep moving around as we get access to more doses. And just as a reminder, largest dose allotment since the beginning of this process, 4,040 doses for the county health department this week. Additionally, in partnership with Marist, New York State Department of Health, and Westchester Medical, they'll be opening up a 7-day clinic at Marist campus. That'll be open to anyone, but look for emails once those links become available to schedule with the state of New York. That'll be about 500 doses a day for 7 days. And as I mentioned, working with Caremount and Premier, we'll be identifying homebound seniors and begin the process of getting vaccines to them as well. How do you address people signing up multiple times on the vaccine wait list? That's a great question. We deduplicate it. What that means is the system itself identifies similar names, addresses, emails, and we identify if these are duplicates, and you're deduped. So you shouldn't sign up more than once. There is absolutely no need to sign up for yourself more than once. But using all those data points, and some of them are mandatory, we're able then to identify if there are duplicates. So it isn't just an email address, right? Because we could have 5 people signed up with a single email address. It isn't only someone's street address, because there'll be five or two or three people, maybe five, 2 or 3 people at that particular street address. It's using all of those data points, and they identify the duplicates. And I'd also say we don't just throw them away. We just don't circulate amongst them, and that allows us to go through to be sure that we're always accurate. So again, a very simple but important process that occurs by using the database technology that we've been using. And if you'd like to sign up, with us, be sure to visit duchessny.gov/vaccine-info form. It's a very important opportunity to get on our wait list. And that's how we're doing it. So you don't have to call us. You don't have to check back 7 times when appointments become available. If we know in advance that appointments are going to become available, we'll actually email you and say tomorrow, look for an email from us scheduling for your appointment. If we don't know that they're coming, for instance, we don't necessarily know when the state's going to open up access to the Marist College pop-up, but as soon as it does, we're going to email you and get that information out to you so you can sign up. Okay? What do you have to do to bring to your appointment for a vaccine? Well, it depends, right? So if you have a comorbidity, this is an underlying health risk of some kind. If you have a comorbidity, we have a form online that you can simply print out and get signed by a doctor or pharmacist. Otherwise, any letter from a physician or pharmacist acknowledging you have one of these comorbidities. We're not going to ask which ones. We have no right to know which one you have, and we're not going to ask, nor should anyone. But if you have a physician's note that just simply says, Mr. Smith has one of the identified comorbidities, signed by a physician, signed by a pharmacist, that's all you need to qualify as for comorbidity. Otherwise, you're doing a personal attestation that you're a senior citizen or that you are an essential worker. We may ask for an identification of some kind just to prove that you are who signed up, but you do need that letter from a pharmacist or physician claiming that you as an individual have any one of the identified comorbidities. Can I get my second shot at a different location? No, you cannot, except we are aware that some of the pharmacies in the region, I think in the state, are telling some people that they may have to go to another one of their branches to get the second dose. I have no control over that, so please pay attention when you're getting your dose at any location. Please be sure that they are planning to coordinate your second dose. If it is a local health department local health department clinic, we give you your appointment on your way out from your first appointment. So your second dose is scheduled when you've completed your first dose, and it will be at the same location. So no, you can't jump around. And also, you want to be very much aware that if you've received the Moderna first shot, you need the Moderna second shot. If you've received the Pfizer first shot, you need the Pfizer second shot. Now the good news is with the Johnson & Johnson shot, if you choose, and again, you're going to see more of that available. The Johnson & Johnson shot is a single-dose vaccine, and many of our pop-up clinics are going to be single doses. Why? Because it's very logistically difficult to randomly pick locations that we can be back to in 4 weeks and set up the entire operation again. The other thing I'm going to say is I think you're going to see now federally across the country, as the Johnson & Johnson shot is now more readily available, you're going to see more of that administration and that dose. And some of you may ask, well, I heard it's less effective. And so I won't pretend to be a doctor, but I will tell you what we've learned through the physicians that have talked about it. The Johnson & Johnson dose falls within the effective rates, if you will, for a vaccine. And if we're talking about any other vaccine where general use, the Johnson & Johnson shot is effective. It is. Now, it is more effective in the 85 to 90% effective rate for severe cases of COVID-19. So in the case of this virus, the Johnson & Johnson dose will minimize the risk of a severe case and be more effective for those that are and be very effective in keeping an individual from getting a severe case. So that's the Johnson & Johnson site. And I would tell you again, most of the pop-up clinics, so if it's not a permanent location, most of the pop-up clinics are going to be Johnson & Johnson doses. The Marist one, the ones that we are planning to have in East Fishkill, Beacon, Millerton, those are likely to be Johnson & Johnson doses. Brookmead, and that pop-up, because it's in partnership with a pharmacy, is the 2-dose allocation, and that'll be coordinated on your way out the door. Any additional questions, write them in the comments section below. Otherwise, we've covered just about everything, and I don't think we need to prolong this evening. Again, we will be live with you again next Wednesday, and do want you to participate in that if you can. 3 p.m. on March the 10th, and then 5:30 p.m. on March 24th. We'll be hosting our Facebook and telephone live town hall, and we'll conduct that as we can. Now, we've talked a lot about getting the vaccine. We don't have Dr. Wyden or any physician with us today, but we do have a special guest. And we're going to close with our special guest today. We have Dolly Parton. Now, we don't have Dolly Parton. Do we have Dolly Parton live? Is she with us? We're obviously we want you to make the choice, right? You should ask your physician, ask your medical provider, ask your healthcare provider what's best for you. And I will tell you again, when 45-year-olds that are healthy have access to the vaccine, I'm getting the vaccine. I don't know which one. I'll get the one they give me. I do technically qualify now as county executive as an essential responder, but I did not want to be in a position where I jumped ahead of fire, police, teachers, what have you. And so when that opens up, I'm going to get my vaccine. But we do know that a lot of people are hesitant, and we do know that it is your choice. So we're going to be here over these next few weeks to answer questions. We're going to provide you with information we can, and we'll leave to others to help encourage you. So we're actually going to close today. She's a little tough, that Dolly Parton. I know that we all think she's very sweet. I think she's a remarkable human being. She donated dollars to the development of the vaccine. And I will tell you, in her home state, if you saw this, her home state was going to honor her with a statue. She declined and said perhaps someday when she goes to the afterlife, perhaps they might have a statue, but she doesn't need to be alive for it now, and declined having that recognition, which is not something everybody would do. But I think, she's a tremendous songwriter and a good humanitarian, and she's pretty tough, but she got her vaccine and shared a little song that she helped write, and we're going to close with that. So in the meantime, stay strong, stay healthy, and be kind to each other. And here's our good friend Dolly Parton.
Well, hey, it's me. I'm finally going to get my vaccine. I'm so excited. I've been waiting a while. I'm old enough to get it, and I'm smart enough to get it. So I'm very happy that I'm going to get my Moderna shot today. And I wanted to tell everybody, I think you should get out there and do it too. I even changed one of my songs to fit the occasion. It goes, vaccine, 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 vaccine. I'm begging of you, please don't hesitate. Vaccine, 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 vaccine. Because once you're dead, then that's a bit too late. I know I'm trying to be funny now, but I'm dead serious about the vaccine. I think we all want to get back to normal, whatever that is, and that would be a great shot in the arm, wouldn't it, if we could get back to that. But anyhow, I just wanted to encourage everybody, because the sooner we get to feeling better, the sooner we are going to get back to being normal. So I just want to say to all of you cowards out there, don't be such a chicken squat. Get out there and get your shot.